All right, you guys, Ralph Havens here, physical therapist at Beyond Limits Physical Therapy in Bellingham, and Tom Gimateo, chiropractor, naturopath, Dr. Tom Gimateo, IMT developer, integrated manual therapy. And it's our podcast when doctors don't have answers yet, or your therapists don't have answers yet. And today I want to bring Tom in to talk about chronic pain. Some people call it complex regional pain syndrome or reflex sympathetic dystrophy, it used to be called. And some people think it's all in your head, and there's all sorts of different methods about trying to use that sort of psychological type approach, I suppose you'd call it, to solve this. But Tom, it's so good to see you. And this is our wheelhouse. This is the stuff, chronic pain. If there's one thing IMT has an answer for, it's stuff that's not going away. So welcome. Thank you for being here. I'd love to just dive right in and anything you have to say about your journey, chiropractor, naturopath, physical therapist, acupuncturist, developer of IMT. This with you, your world, you basically could be healing.com.
Right.
Tell us a little bit about your thoughts on these chronic pains that limit so many people.
Hi, everybody. I feel if you've been assigned by your medical practitioner to go see a pain clinic, we may have answers outside we have like a 20 to 30% chance of helping you. And especially if you've gone to the pain, your regular doctor has said, no, we need to go get you pain specialist and put you on meds. And you've already tried a chiropractor or an acupuncture or a physical therapist. Sometimes it's simple. Sometimes it just needs to get a good massage. Sometimes it needs a few needles from acupuncture. Sometimes it just needs a little stretching and a strengthening activity, all to work on those different items in the body. So where IMT or integrated manual therapy approaches is if all those have not worked, then you're probably a little bit more complex. Maybe 50% of the pain actually started in the area that you have the pain, and maybe 50% of it has happened in other places, like the close to your neck. That's called a brachial plexus syndrome. And regional complex reflex disorder, or RSD, we like to call it for short. I'm an old timer. That is slightly different. It's something that happens when you've had a procedure, had a surgery, and then that one half of the body or 1/3 of the body, you just rub the skin and it blows up, it gets inflamed. Another one that's on the spectrum is Raynaud's disease. And those are all different types of using the central brain and the peripheral brain to do that. And it's not one specific thing, it's a bunch of things. And so IMT has about 150 different types of technique, one for the muscle, one for the bones, one for the artery, one for the lymph nodes. And it depends on that whole process. The case study I'd like to present to you, which is now maybe 8 or 9 years old, is we had a 40-year-old woman come in that suffered from RSD, or complex regional pain disorder, in her right leg. And every 3 to 4 months, she would go in and have a surgical procedure, which was a nerve block under anesthesia, where the doctor would inject the lower leg and numb her up. And she'd wait to the very last moment that she'd almost be in a wheelchair. And so she did this for 20 years. Every 4 months, she'd go in, have 2 or 3 months of that. She had pain, but she was able to walk around, and she'd find that the pain was so bad she'd be in a wheelchair. And one time she got so weak after the procedure, they sent her to a rehab hospital, and a physical therapist did 2 of our strain counter strain techniques, and she was out in a half a day. And the therapist said, well, go see these guys because they can really help you down in West Hartford where we were. And she was maybe 2 hours away of a drive. It took her a year to come in to do that with us. And so for 20 years, this woman, every 4 months, incredible pain, all these 20 years after having a bunionectomy, which is helping the bottom of the toes. And so for 20 years, she kept being in this cycle. And she was so sensitive, even walking into the room and on concrete, she could feel the vibrations of that whole thing. And her pants bothered her, her socks bothered her. And we took in the whole history. And, two out of the four things that we said are crazy for the nervous system. One is processed sugars. Anything that's not honey or maple syrup is a processed sugar to us. And also gluten intolerance, which means wheat, oats, barley, and rye. And then we don't also like almonds and peanuts. They all inflame the nervous system and make you hypersensitive. So we found out she was drinking 2 liters of Diet Coke a day and having the aspartame of the Diet Coke. We took her off of gluten, and within 3 weeks she came back, and she came in a wheelchair. She came out. She came in the next week on a cane, and since the day she walked into my office to now, she's never needed another surgery, and she's functioning throughout her life. And she comes in for a tune-up maybe once every 2 to 5 months, or if she gets in trouble, like she fell, slipped on the ice and that flared it up, or she had a car accident. But she knows how to survive and 95% out of pain, and she can see it creeping up with all these other injuries. So that's what we add to this. And don't give up hope if it's just you didn't find the right therapy. But IMT combines all those different things together to do that process. She's even flown to Australia, and has had wonderful times that way too.
That's awesome, Tom. And how much was the diet and getting rid of the diet drinks the thing? And did you do something extra with the IMT, like with the hands-on manual therapy that was part of the healing help?
I feel, Ralph, it was a combination of all that that really helped her out. We had to go in and injecting the spinal column and putting lidocaines and other things in there caused scar tissue. So we had to help get the whole tissue loosened up, break down the scar tissue she had, and get it to a place where we could feel normal muscle integrity and normal nerve tensions there at the same time. So it was a combination. She felt immediately better after we released different parts of her body. We've talked in the past about a phenomenon called a descended sacrum, where the whole spinal cord feels like it's on 20 pounds of tension all the time. And that was part of the first release.
That's usually one of my first sessions, and I've got somebody coming up today with I've already heard the history and big accidents that absolutely would cause that descendant phenomena. And so it's a manual therapy technique, and then yet it's also very important for when you see something like that, diet drinks and the gluten and the sugar and the peanuts, shifting that can be a really big thing for somebody. When you do the manual therapy, it sounds like how could that possibly work? Like you talked about scar tissue in the spinal cord. You're not talking about a deep tissue pushed down into the spinal cord with your elbow kind of thing, or stretch the heck out of it. How does IMT work? What is it? How is it different than I know the answers to this, but it's like I get this a lot. I was at a run clinic, a running group yesterday, and they had a Thai massage guy giving away a free session, and I thought, and a couple of them were talking about how great it was to get really stretched out and get those elbows in there and all this pressure. And IMT isn't that. So what's the deal with IMT? Like, how can you possibly work on a spinal cord?
Well, fascia is a unique tissue in the body, and it's the Teflon for the body. And there's many different techniques called myofascial release, and Thai massage is a type of myofascial release. But we found gentle is better. Sometimes it's almost like if you had we want to redefine the tissues and make them glide on each other. So if you had a soda bottle or a beer bottle, and during the summertime we put it in a big cooler, and you go grab the bottle and the label slides right off into your hand. that's the ideal tissue system between your muscles, your bones, your ligament and tissue and tendons and arteries and everything has to go. But when that bottle's been dry and you try to peel off that label, you're leaving paper on that whole piece, right?
Yeah.
And in that paper, there's nerve endings, so it actually creates more pain sometimes. So again, if you've tried some stretching and you feel twice as bad, you're probably ripping and tearing things at the same time. A Thai massage or a deep massage, you feel like you got beat up for 2 or 3 days or even 2 or 3 weeks later. But do you actually improve your range of motion? Do you get more glide with it, right? And so what happens in fascia, it's almost like your whole body is 12 layers of socks on one area or 12 layers of pantyhose. I like to with the lady population, and they know when they're putting on their pantyhose that if it doesn't go on straight, it feels like their leg flops out to the side. So that fascia actually glides, okay? And what happens is that when you have gliding fascia, it should smoothly go over each other. And when you have an injury, it actually tears and rolls in on itself and almost makes a hooklet, almost like a bra hook. And if you pull the wrong way, it gets tighter. And then what general stretching does is rip that apart, and now you have a little more injury, right? I recently took a dry needling course, and through my 40 to 50 years of studying different techniques, I don't, Botox injections and trigger point injections have been used in tools, and these Gronstedt bars are taking metal and shaving it, which is gua sha in Chinese medicine, and creating black and blue marks actually causes more tissue damage in our world, right? So
Yeah.
we actually go back the other way and release it one step at a time and unhook it and it actually unfolds. And my example is if you have a gold chain and it's got a knot in it, like a Thai massage is taking your elbow and trying to untangle the knot from the center instead of taking the chains and loosening them up and then pull it apart gently. And that's where I am.
That's the difference with IMT. It's like
Yeah.
letting it go where it wants to go and then letting it unravel. When we do the techniques on people, some people feel the unraveling. I've had people say, it feels like I'm moving my hands, and I'm telling them I'm not moving my hands. I'm holding it in a position of ease, and that's your body unraveling the situation. So IMT is quite different like that. Some people go into this, there's this guy, Mark Sarno, which I know you know about. And I was talking to a therapist that's here in the building that does the advanced versions of this. And she says there's lots of science around using the nervous system to calm things down with these complex regional pain syndromes. And it kind of sounds like, is it in your mind and you're using your mind? What do you think of those kind of approaches?
Mark's, I don't know, it's information is wonderful, right? I feel the combination of that and our gentle body work amplifies and augments each other along the way. And you've heard this 100 times from me in class that when I tell clients when we're looking at a chronic pain syndrome, number one, pain comes in 32 flavors, right? Sharp, dull, burning, stabbing, icy, glassy sensations. And a lot of people that have been in pain for a very long time just say, no, it hurts. I don't know. My shoulder hurts. And I ask them, can you point to where it hurts? And they say, no, it's just in here. So as we have tissue damage over time, we jump out of our bodies. And Mark is wonderful in getting the mind, body, brain connection to go through. And again, Chinese medicine is 3,000 to 6,000 years old, and they have relationships of organs and feelings and emotions connected to each tissue piece. A
Yeah.
newer author of that is Louise Hay, You Can Heal Your Life, and she talked about what the symbolic meaning is on those pieces. The interesting thing about IMT or integrated manual therapy is we just don't see it as a tissue problem. We see it as a mind problem. We see it as a spiritual problem also. And any of those branches can pull on the other branch. right?
And key, we have this myofascial mapping to find the primary thing. Like in some cases, can it be that Mark Sarno version is the primary thing that needs to be addressed, or sometimes it's some fascial thing that you find that needs to be addressed, or a bone issue, a bone bruise as the primary. Like it seems like, how would you find where to go work? We have this myofascial mapping.
It's our roadmap, right? And it's I think that's the flagship of understanding integrated manual therapy, and any of your healers that are, or body workers that are listening. It's all about looking at what is the primary cause. And the other piece is, I first said that it comes in 32 flavors. The other process of that is that taking a hammer and smashing your thumb is only a level 0 to 1 or 2 or 3 in the pain, and emotional pain and mental pain ranges from 3 to 8, and then spiritual pain is actually 8, 9, and 10 in that whole process. Are you on your path spiritually? Are you able to reflect what you need? If we worry too much, we get a stomach ulcer. If you keep worrying, it can turn into cancer. So we really take that holistic approach. And the thing is hard when somebody is stuck in a medical model. Oh, my elbow hurts, it must be tendonitis. So, but it could also be holding on to life or not controlling life. And for every individual, it's a little bit of all those three things. And sometimes it's a lot of sometimes talk therapy, sometimes you're rubbing it out, and sometimes it's just a shift in your paradigms. So all those can change it in an instant sometimes.
And it's really good to have a map of it to see in this particular person, where's the place to work. Or I'm really excited to talk to this therapist more that does the Mark Sarno work, because I do think it's a great combination. And I noticed that if I'm in if there's somebody in my world that's not treating me very well, especially if they're, I've got great relationships, but every once in a while you run into somebody that just gets a little funny around you and doesn't treat you right. And it can cause an actual pain, a little pain somewhere in the body. And if you go and just rub it out, it might not fix it. So that is a part of it for sure.
And just speaking on that level for a little bit, the last 2 or 3 weeks, there's been a really huge amount of depression and anxiety being caused. And I have a newsletter, and we're up to 28 newsletters. And Ralph, you can attach this later on, as I put out a simple 11-step process of holding your hands to different body parts that are really helping on the 28th newsletter about depression, anxiety, self-worth processes.
Thank you. I will put that in every place that you find this, and then make a special page for that to get to people. And so to reach Tom, IMTwellnesscenter.com. He's got a lot of resources, a lot of stuff. There's a lot of really amazing books. Body Wisdom has more of those hand touch things you can do to yourself. So IMTwellnesscenter.com in West Hartford, Connecticut, and worldwide. And he can talk to you and help you see what's going on with you, and find how to get you the help you need. If you're dealing with a pain that isn't going away, if the practitioners haven't helped yet, it's good to talk to him. The number is 860-561-2286 on Main Street in West Hartford. I'm at ralphhavens.com here in Bellingham, Washington, and 360-599-2217. I guess the main message today is, if you've got a chronic pain that's just not healing up, like Tom and I have both had to heal ourselves up of chronic stuff over the years, and it's led us on this path to find these different answers for people. And if you've got something that's not fixing up, I encourage you to call us, and we can kind of get you steered on what we see that's going on. So, and I'll get this newsletter out to you. There's also some training you do every week for therapists, manual therapists. So reach out to Tom if you're a therapist. Reach out to me, and we can direct you wherever you are in your path to healing. And Tom and I are here to get this integrated manual therapy out to the people that could use it. And Tom, anything else you want to say to the world about My hope today is that this message reaches the people with those things called complex regional pain syndrome and reflex sympathetic dystrophy and chronic pain, and they've been searching and searching and searching and trying lots of stuff, and it's just not working yet. Anything else?
I usually say we're usually the last people you get to hear about, and don't lose hope that there may be an answer for you, and give us, an evaluation and maybe 4 hours of therapy, 4 visits. And if we change your life 5 to 10%, this works for you, right?
A great idea. And I
You
just
should be able to see it in 5 visits.
Yeah, some people come in for an hour and it's like, oh man, let's do the best we can in this hour. And it can make a big difference. People feel way different. We even have very short things that we do on our free Thursday evening community sessions here. But man, yeah, if you've got a big problem, I think it's worth it, some significant time. So well, thank you, Tom. I will
Okay, Ralph.
everywhere, and let me click everything off, and then